as a care receiver and as a care provider, Ashla has more experience in this field than anyone is likely to have in this group. The words she will speak will be authentic. I can speak only theory. I'm here with to jump in and say anything when I feel I need to, but Ashla will take the lead today. With me is a guest, this is Ms. Rama Nagarajan. She is a journalist from Delhi, a very well-known journalist from the Times of India, as an observer today. So, Ashla, please go ahead.
Thank you, sir. Yeah. So, good afternoon, everyone. So happy to be here with you all today. So, and thank you for coming in, joining this FCPC, wanting to learn more about palliative care and implement that into your practices. So thank you so much for that thought. So we will start with a definition of what is disability. So this is, I just got it from WHO definition and changed some wordings so that it is easy for you to follow. So the three words which I want you to look at in this definition is disability is about an impairment which is causing an activity limitation and also a participation restriction for a person. So, and it comes in between a person's interaction with its society. So this is how I would like to explain it. So I have an impairment. I cannot walk. I cannot use my legs to walk. And I live in an environment and I live with a society, in a society. So when does my impairment become a disability? It is when my environment is not helping me to move around freely and the attitude of people in the society is not welcoming. I use an electric wheelchair, so I can manage that on my own. But when my environment is not friendly for a wheelchair, I'm not able to move around. And when you as a society is not welcoming me into the society, I'll not feel welcomed or included. So the moment I'm able to use my wheelchair freely and I'm able to interact with you all freely, so there is no disability because my inability to walk is not affecting me as a person in moving around or in interacting with the society. So when that is assured, there is no disability. So for an impairment to become disability, we have contributions from the environment and from the attitude of the society. So that is something which I hope you will all remember, that we have a choice to make an impairment, not an impairment, or not affect a person's working or person's functionality. So we have a choice as an active member of society. So I hope you will remember that for future. So when it comes to some key facts for
Ashla?
Disability, sorry,
Ashla, sorry, can you jump in and ask you, request you to go back to the previous slide? No, the previous one.
Sure.
Just want to get wrap my mind about the impairment, activity limitation, and participation restriction.
Yes.
So from what you said later, what I understand is the physical impairments and activity limitation, you are able to overcome with your wheelchair and with facilitatory environments. if your participation is not respected. Is that what you mean to say?
Yes. Like my inability to walk is not affecting my participation into the society when there is a conducive environment. There is a friendly environment and there is a society which is welcoming me and including me into the society. It is not that my bodily function, the problem in my bodily function, which is an impairment, is not affecting me, and then that is not a disability. When it is becoming a disability is when it is not letting me participate, when it is limiting my activity, and when it is restricting my participation as an individual to the society. So is that
Got it,
clear
got it.
now?
Right, thanks.
Okay. So we have so many people around the world who is living with some form of disability. WHO says that we have over 1 billion people in the world, and it is increasing dramatically because of this chronic health conditions and other reasons. And it is like we all experience some form of disability, temporary or permanent, at some point of time in our life. That studies show that only 1 in 10 people die a sudden death. So we'll all have our own experience of some form of disability when it is either by old age and end of life situations and all, or by an accident or whatever it is. So almost all of us are likely to experience some form of disability in our life at some point of time.
Ashla,
So,
again, trying to understand it fully. What you mean to say is not only, okay, some form of disability, but some significant disability for some significant length of time at some point in our lives. That's what I get from it. In the sense, I'm only not talking about a cataract impairing my vision for a period of time. I'm more talking about being bedbound, dependent on others for daily activities of daily living, etc. And along with that, I am also taking in your previous message that at that time also, people around me and my environment may have the ability to take me out of my disability by facilitating my activities and by empowering me to overcome my disability. Would that be a fair statement?
yes, sir, and participate in daily life as long as possible, as much as possible. By facilitating that, we'll be able to overcome that disability. May not be 100%, but that actually gives a quality of life to a person when we are able to do that.
Actually, I was wondering whether the participants um, had already taken that message in, or did they find it a revelation, or did some people have a questions in their minds? How can that be, etc.? Shall we check to see if anybody has any questions or comments
Sure.
on this?
Sure, please. I would like this to be an interactive session. So,
Senior, just give 30 seconds of quiet time so that people can think and formulate a question or answer.
okay, there is a hand raised already.
Okay.
So
Not
please
33.
unmute yourself and talk.
Abhijit. Abhijit?
Yeah. So, would you tell us is there a comprehensive definition of disability, meaning that can bring in all the elements that you are expressing now? I mean,
Sorry, Abhijit, can you repeat the question? I did not understand.
is there a comprehensive, like an all-inclusive definition of disability? What disability is?
Abhijit, I thought this Ashla was giving you practically the WHO definition of disability.
Okay.
Only thing is a long distance sentence. She has broken down to 3 bullet points.
Okay.
Right, Ashla, please
Fine,
correct me if I'm wrong.
Yes,
Right.
that is the WHO
Okay.
definition.
Definition.
Okay, I just told you that
Maybe
it is an adapted from WHO because I removed couple of words which were redundant so that it is
Okay.
easy for you to take in those
Yeah.
three keywords. So this
But
is the definition of from WHO.
Can you show
And I
that
can
slide
send,
again? Can you show
okay,
that slide again?
sure,
I
sure.
think I missed it then. Sorry.
This is
Okay.
the WHO. And
Okay.
I can send you with Senior the complete definition, the words which I
Great.
removed from this, and I can send it across to you.
Yeah. Sorry, I missed it. Thank you.
Okay, the next person, please.
Hi, ma'am. This is Srinivas here, this side.
Okay, tell me,
In the
Srinivas.
first slide, you focused about the basically the impairment, the activity limitation, and participation restriction.
Yes.
So, if there is an impairment, as sir has rightly pointed out, whether you have some problem to that. So, example, if you have a amputation or anything, you got your artificial limb placement done, and you have been on the track of getting it done actually. But I didn't understand in the participation restriction. Is a problem in involvement in life situations. Means, can you explain in little detail, ma'am?
Yes.
Because
Sorry. I'm sorry.
yeah,
that I
you can go ahead, ma'am. Yeah.
Okay. So the activity limitation would be the activity like whether how do I I can't hold a pen and write with my ball. I can't use a ball pen to write. So I use a soft nib pen to uh, sign my documents or write something or draw something. So activity limitation is an activity in doing a task or an action. But the participation restriction would mean that how do I participate in a societal, like as a person, how do I participate in my activities which requires like as a person, we all work, we all have a role in a society to perform, in a family to perform, in an office to perform. So how do we do that is the participation restriction, which I understand. And the activity limitation is a specific task which I would want in my daily life. This is how I understand this.
Srinivas
is
and
that-
Ashla,
Sorry, sir.
let me see if I get it right.
Hmm.
You have quadriplegia, you live with quadriplegia.
Yes.
But if you are given a felt pen, your activity limitation is overcome and your participation restriction is overcome. I mean, that's the simplest example. In another way, in our country, for most people with paraplegia or quadriplegia, the disability is caused more by having roads that are not accessible, payments that are not accessible, vehicles that are not accessible. If, as you have an electric wheelchair, you have a ramp to go downstairs, you have an accessible vehicle into which you can climb in, then the disability is at least lessened. There may still be some impairment, but the active limitation of activity or participation is overcome.
Yes, sir, exactly. So my impairment of not being able to walk or use my legs and hands properly, that is not limiting me from my activities or my participation as a citizen to the society. I'm able to go out, I'm able to participate in the in my daily needs. So that is what is mean by
Ashla, so
participation.
if this may be applicable to anyone in the group,
Hmm.
if there is a parent or a grandparent or an uncle or aunt who is elderly and frail and unable to walk by oneself, the natural sequence that happens in most families is that when they get together as a family, whether it's in the living room or in the dining room, this person will be left out. Others will sit together and talk, and the food is taken to that person, but he is not participating anymore. That elderly, frail person's disability, impairment, does not become a major disability if somebody remembers and asks grandpa, hey, grandpa, we are all sitting and talking in the living room. Shall I help you to the wheelchair? Shall we go there?
Yes, exactly. Or either you get together in the room,
Yeah.
depending upon, like, it is about, that's why I wanted to show this attitude, because the moment we have an attitude, we understand that, okay, this is what is happening, and we recognize that, and we are ready to take some action towards that. There are so much which we can do and which we can overcome the limitations to include that person, to give life to that person, to help that person. So all these together is what is causing. So the moment your attitude towards the person with disability changes, the whole concept of disability itself changes. Are there any other questions?
Emma, you have a comment or a question?
No.
Okay, so we'll just go. So please feel free to raise your hand whenever you have something to comment on or to ask. Anytime. So, okay, yeah, this is also which is told by WHO, that people with disability, when they access healthcare, often they experience stigma and discrimination and receive poor quality of services. And there comes the next statement, which says that, okay, we have an urgent need to scale up disability inclusion in all levels of health system. And this is told by WHO, that particularly primary healthcare. But I feel in a country like India, like, we don't just need at primary level, but at all levels. Our understanding about disability as a healthcare professional is also very less. So that causes this stigma and discrimination and poor quality of services. And because we are not able to include that, also creates a lot of serious health related issues which can be prevented, suffering which can be prevented. So even the rehabilitation services, which are very minimal, and we only get very tiny fraction of people get access to it when they need it. So at all these levels, we need to scale up the disability inclusion.
Ashla,
Yes, sir.
is that true that our all levels of hospital, you said our say, big hospitals, you have yourself experienced life in a hospital for years. I mean, can you give me an example of that stigma that you are talking about?
Any sir, in any hospital, if it is a rehabilitation hospital, okay, of course, my daily activities are focused. But otherwise, when we go to I'll give you another example here, wherein, how do I say that? Give me a moment to. So this is not not about my experience, sir. But when you talk about stigma and discrimination, when you go to a hospital and talk about, I read about this, but I have not experienced this kind of issues. So when you go to hospital with some issues, the moment when you don't have a disability sensitization for the professionals, all these questions which I go with a fever or I go with a toothache, but the questions which are asked are about my disability and about what happened to me, how it is, and which is nothing relevant to the issues. of about my health issues right now, which I've gone to a person or a professional. That happens, and many times why a discrimination is because we are not able to access certain facilities even if we reach the hospital. I reach the hospital, but how accessible your scanning table is for me, how welcome people there, and how they are helping me to get into that. Am I experiencing a stigma there? How am I treated in that X-ray table or a scanning machine? So these are the kind of issues. Even I have experienced that many times when you have to have people to help you from wheelchair to an X-ray table, how accessible it is and how you are treated in that particular way. I think that is what they are talking about when we talk about experiencing stigma and discrimination, the way you are treated in the healthcare facilities. So I have Srinivas who raised hand. Tell me, Srinivas.
Yeah, ma'am. So, in order to add to this point, as you have rightly said, people in the society have some kind of pre-assumed notions in their mind, stating that if they see any person with some disability, they think that they stereotype them that he's meant for this and he cannot. So, if we see a person with some disability coming on a wheelchair to a movie for a recreation to a movie hall, people generally the society thinks that what is the need of he coming with this disability to a cinema hall, what is the necessity, he can sit at home, now why is he troubling himself? But they don't think in the other way that he's also a same individual like you who has come to watch the movie. So that kind of a discrimination and that kind of a stigma which is existing between them. And also regarding the poor quality of services, which is they have that already the patient has come from an impairment stage to a disability stage, and where they think that what we can offer, the kind of services what we can offer to the disabled people are very less. They say that we cannot do much on him. Instead of thinking what best we can give it to him, they limit themselves that he's already disabled, he's carrying his life, so we cannot do much in him, please, oh, this is what we can do. But there is a lot more they can do in talking to the person who is having the issues and improving his quality of life, though in that way I think that they are receiving poor quality of service.
Yes, thank you. Thank you, Srinivas, for adding that words of wisdom to this. So, shall we go to the next slide? Okay. So, this is also one of the studies which came that in most countries, disability is found to be significantly associated with poverty, lower educational attainment, lower employment rates, and higher medical expenditure. It's like when you have a congenital disability, your opportunities for education are very minimal in our place, and especially and also when you meet with an accident and acquire a disability during your studies, and we have seen those kind of people, like many people who had to discontinue their studies because they were in the middle of a course and then their college were not welcoming, not accessible, and they couldn't afford to be there to reach the college. So they had to fall out of their studies. And then, of course, employment. The moment you are not educated enough, the employment opportunities are very minimal. And higher medical expenditure always. I'm coming to the next slide when I can explain that. So higher medical costs are affecting people from accessing healthcare. So what are the barriers for accessing healthcare? Accessibility, how easy it is for us to reach to a hospital. How are you able to go? Are you able to go on your own, or you need somebody else to go with you? And high cost of transport. Are you able to take a bus, or you have to hire a vehicle? And do you have the money with you to go? So what happens when you one night you are going to your sleep and you get a toothache and you are not able to like sleep that night. You feel you have a sleepless night, and what do the next day? You just get to the nearest clinic and you get your teeth attended by a doctor. So what do I got a toothache 2-3 months back. I had to extract one of my like teeth, and you know what happened? One of my colleagues had to make many calls to understand where there is an accessible clinic available, because most of the dental clinics are on the second floor without lift, or there are so many steps in front, or your dental chair is not accessible. And finally we found one, and then I had to arrange somebody to take me a vehicle and people to carry me from wheelchair to the vehicle and from there to my wheelchair so that I can get to the clinic. And then like my mother had to come with me, along with me. So, and I live in a place, I stay and work here in Palim, India, which is my family. So it's a big family of many people, and I have access to doctors who can check about accessibility about the clinic, get the information to me, and I have many colleagues who can take turns and help me to my wheelchair and to vehicle and come along with me, along with the driver, and get me there and get this done. So I can only imagine what it would have been for me and my mother if we were staying back in my village where there is no accessibility, no road facility, no people around to help, and nobody to see, give us the information to. So that is what happens, and that is why I'm talking about barriers to access healthcare. So all these factors are affecting me, and all these factors are preventing me from accessing the healthcare facility which I need at some point of time. So that is why we have to reach people where they are when they need this kind of facility. So just to show you, these are the kind of terrain which we reach as Palim India's home visit team reach, and that is where we care for people with disabilities also, whether they are bed bound or wheelchair bound. And when they have a health related suffering, we reach where they are and we try to solve that issue and provide them with whatever support which they need. Srinivas, did you raise? Do you have any?
No, no, ma'am. I'm just
Okay,
clapping for the work.
okay.
Yeah.
Thank you. So here we comes, what can we do? What can palliative care do? So, and as we already talked about, that the disability which is not causing any issues in a high income countries and developed world where they have proper rehabilitation services, where they have access to the public places and where society is welcoming them, they don't experience so much of serious health related suffering due to that disability. But in a country like ours, that physical disability itself, like I have a quadriplegia, I have a spinal cord injury, and that in itself is causing serious health related suffering, because my rehabilitation facilities are very limited, and there is no talk about how do my indolent catheter can be into an ICC so that I don't need to go to a hospital to get it changed every month. Or how do I prevent? What is my opportunities for education on how to manage my spinal cord injury? How do I care for my skin? How do I care for any secondary complications so that my health is not affected much? We don't even understand that, okay, spinal cord injury is something to be managed. We will not be able to cure it, but it is something to be managed so that we can have a proper quality of life until we live. So, and we have many times we have seen people dying from secondary complications like infections from pressure sores, infections, repeated urinary tract infections, etc. And we are not taught about how to prevent them, how to expect and how to prevent, how to manage these kind of situations. So what we can do is we can teach these people, we can teach the caregivers, we can teach the patients about how to manage these kind of situations. And when there are serious health related suffering, we can intervene early and we can prevent that suffering. We can prevent whatever is possible. We can treat what is existing at the moment so that the quality of life is improved and we mitigate the suffering and we prevent whatever is possible. So, and to say this, and most of the palliative care centers in Kerala has included people with disabilities, and many of them when they start, or at least some of them when they started as providing just palliative, just the symptom management kind of, they got into the rehabilitation spectrum and working especially for only for people with disabilities and rehabilitating them back to the society. There are many who are doing this service in Kerala now. So do you have anything to add?
No, please go on.
Okay, so this is, I actually got this statement. Like I always feel that, okay, when I keep receiving all the care which I need and just sit at one place, like if I stay home and I get access to everything, I get 3 times food, my mom will give me a bath, and then I'll have the TV rolled onto my room so that I can watch TV and I can spend all my day as it is. But what is that? What am I doing to my society when I do that? I'm just using all the resources which I need or which is available, and I'm not giving anything back. So if I'm part of that society, so I'm not contributing anything to that society. So even with health, it is the same. Health of a society is total health, and when I am unhealthy, the society's health is affected by that. So that when that is treated and when I'm healthy and I'm contributing, I believe that the total health of my society is improved because of that. So what you can do for that? You as a healthcare professional can sensitize yourself for the specific issues and challenges, and you can learn more about disability so that you you improve the quality of life of these people and you help them to be contributing citizens of the society. And there is one more thing which we can do. You see, the moment you uh, get a disability, what happens to you is that your sense of control, you lose your sense of control. So that is something which is so important for us, that okay, you need to see that you are taking decisions in your life. How many times you're always asked whether you want tea or coffee, and you have a say in that, you want what, and you would like to eat what. So, and when you have a disability, the moment you have a disability or the moment you have a chronic illness and you depend on others, all these are people decide for you. Coffee is not good for you, and maybe non-veg food, this food is not good for you, or this is good for you, so you eat. You are like asked to eat all these bitter foods which you don't like it because it is good for your health, and you use your sense of control. You don't have a say in that because you depend on them to feed you, right? And you depend on them to at least serve you the food. You can't cook your food, you can't order for your food, so you depend on others. So decision making, that ability to control or that sense of control is very important. And I say this mostly from my own experience because that was something which was very difficult uh, to come into terms with, that you don't have any decision making powers at all. But uh, just because I have a disability, that doesn't mean that I'm not able to take any decisions at all. I may need your help as a healthcare professionals to take some decisions about my conditions, about my future. How do I take my life ahead and all? But I am able to take that decision when you help me with those kind of right information. So please do that for anybody who comes to you for help. Give the options, help them choose from that, or help them decide on that. You're not just giving them that choice of decision, you're giving them a feeling of dignity, and you're giving them a sense of control over their life. And what else? So this is something which I thought, okay, we all can do, and something which we all need to remember always is that it is not like we as a society. I believe we live as in a society, and we are all together in this. Not just because I told you that at some point of time we are all tend to experience some kind of a disability. That is what statistics shows. Not just because of that, it is also because that whether I have a disability and you are the able person and I am the disabled person, we all live together in this society. So as a society, we have to look at it as not just it is them who are having this disability and you are the able one. It is all of us together living in this society. So because of that, we need to see it as, okay, we need to include everybody, and we need to take it as it is about all of us. And you also should remember that at any point of time or at some point of time, you yourself and your loved ones are going to experience. There are chances for these people to experience this disability. So because of all these reasons, it is about all of us. It is not about I, the person with a disability, and you all, the rest of the society. And I am fighting with you for my rights, or I am fighting for my opportunities. So it is not that, it is we all of us living together. So that is what we can try to do. And the next are something which I thought I'll add here, because we never get a chance to learn about how to deal with, or how do we go and treat these people. Because I have seen it personally that it is very easy to actually deal with children. Like they don't see you as an alien. They just, okay, they play with my electric wheelchair. They just take me for a walk. They don't mind whether I go in a wheelchair. They don't know whether there will be any obstacles on the way, but they just welcome me together. So just come on, let's go. But when the moment we become an adult, we think about all this. Okay, this person is different. This person is lower than me because this person cannot walk, or she can't speak, she can't see. So there are a lot of limitations. So, and then I can't keep the speed with you. I may be going slow. You will have to slow down for me. You will have to wait for me. So all these things are like obstacles for you, and it is slowing you down from your race. So as when we become adults, these grown-ups are actually very difficult to deal with and live with sometimes. So what we can do as a professionals, what we can consciously do as a member of the society, we can learn about how do we treat this person, or how do we actually uh, like behave, or how we actually help these people to become active members of the society. So some etiquettes what we can do. So the first one says that, okay, everyone needs assistance, but everyone needs different kinds of assistance. So, and sometimes, many times I have had my wheelchair, which is an electric one, which weighs around 43 kg, and I'll be some 65 kg. So it is 100 kg, more than 100 kg together. And I have had many times when people were actually pushing my wheelchair. Now that I, with my finger, with whatever ability which I have got, strength which I have got in my hands, I can use my wheelchair and I can go anywhere where it is accessible. I don't need your help to push my wheelchair. But the moment you see me on a wheelchair, you feel so helpless and you want to help me. And the only help you can think of is pushing my wheelchair. And you come and you try to push my wheelchair. But I don't need your help to push my wheelchair, but I may need your help to maybe switch on some lights or fans or open the doors for me, take something for me. So only when you ask me what do I need, you will know and you will be able to help me. And that is there. And then um, like I know what do I need. And even when you use a manual wheelchair and even when you need somebody to push that wheelchair for you, you need to know how do you do it right. Because I was uh, when I was pushing my wheelchair, my manual wheelchair, like I use some ways and I'll have my fingers inside that rim so that I'll be able to propel it. And when people come and unexpectedly push my wheelchair, my fingers go into that and it can hurt. Actually, when you do something without understanding that person's need, you can actually hurt them instead of helping, though you really want to help. And many times we understand that it comes from your feeling of helplessness and you're wanting to help people. But the if you're not pausing to ask that person, what do you need? How do I help? When you're in a group of people, like when you are with a person with disability, just offer that I am here if you need any help. Please don't hesitate to ask me. That gives me the confidence. That gives me the feeling that you are including me into it so that I'll be able to ask when I need anything. But please don't assume anything. Please don't assume the kind of help which I need and start doing it. That may hurt a person, though you are not intending to do it. So that's the first thing to remember. The second is like, okay, treat them as persons. Like I'm not my wheelchair. I'm not only my wheelchair. I'm beyond that. I have a name. I have an identity. I have my own dreams. I have my own opinions. So treat me as a person. This is I you shouldn't be asking me, okay, what happened to you? When did you okay, you fell down from a running train, you were standing in front. That's very bad. You shouldn't do that. I know I shouldn't be doing that, but I did it and I ended up. But I don't need your advice right at this moment when we are meeting as strangers and just getting to know. And did you try this Ayurveda? I know this homeopathic doctor, not that, please, because I've been living this with this for some time, so I know what it is, and it is not the time when you meet me as a stranger. It is not that something which you should be asking me or you should be telling me. Uh, Treat me as you would treat anybody else and ask me those questions. How are you? What is your name? What do you do? Where do you come from? There are a lot of questions which we can ask. So please remember that also. I'm not just my wheelchair. Beyond that. And yeah, this is something so interesting. How many people pat on my shoulder just because I sit in a wheelchair? I'm not talking about friends coming and hugging or friends coming and like holding me, anything. It is mere strangers meeting for the first time, just coming and so patronizing and patting on my shoulder, on my cheek. We all have our own space and our own personal space, but the moment I sit on a wheelchair, you think I'm a 5-year-old. Even that 5-year-old or 8-year-old will not like to be treated that way, but I've been treated that way many times, and we do that to many people without actually understanding what we are doing. And okay, this is one of my favorites. Like, how many times have been people talking to my mother or my friends who are standing next to me asking, oh, what happened to her? She can't walk at all. Is she mentally retarded? Or is this just a physical issue? She can't just walk, or is she mentally retarded? How many times people like shouted at me because I was just trying to go outside and then have some time, have like my evening walks for myself. So they shout at me because they think that I'm going to hurt myself by walking and by crossing the road or by coming out of my house, or they are simply simply disturbed to see somebody like this, somebody who is having a lot of limitations coming outside, because we are all a perfect society. We don't want anybody who is having an issue outside, whether it is an disability or whether it's a deformity or whatever it is. So people, you can talk to me as long as we speak the same language. So you can ask me questions, we can talk to me as a person. You don't need to always talk to somebody who is standing next to me. So, and as I said, when you come and call my wheelchair or trying to help me, just ask me before that, because this is something which I do use. You don't go and like snatch anybody's spectacles, right? This is like we use specs to see clearly, and my wheelchair is also helping me to move around when I can't use my legs. So it is as much as a assistive device as a specs. So you don't touch it, you don't snatch it before you ask somebody for the permission, or whether when before they ask you to help with. And okay, so this is, I think I already shared this. Like, you can talk to me as you would to anybody. So what you do usually is like, okay, the moment you see somebody on a wheelchair, as I said, you associate other disabilities with you. I'm not walking, and the moment you ask me, am I mentally retarded? That question comes from this, that, okay, there is nothing wrong with being intellectually disabled. There are many people who are contributing also, though, with their disabilities. But what is wrong is associating one disabilities with something else. And when people see me in a wheelchair, they assume that I can't read, I can't contribute, I can't converse. That I have had experiences wherein, like, we were all sitting together in a table, and I was not offered a menu card when everybody else were. And when that person came and asked me for an order, I just told him, "You didn't give me a menu card." He apologized, but this is, it's okay. I don't mind so much, but what it shows is, like, as a society, we all think that, okay, the moment somebody is in having an issue with issue, we are associating that with our education, our ability to think, our ability to decision making. So all these, we are associating all these which are not, which shouldn't be there, and which we should be able to look past and at least understand that what we are doing. Okay, and this, yeah, if possible, because I strain my neck when you stand next to me and talk to me. So if possible, just sit down with me and be at my eye level and talk to me. So that is so comfortable to me, and I feel more like friendly and sharing to you when you sit with me and talk to me. So these are all about etiquettes. And I just wanted to show you one single, like, it is a social media post which I wrote many years back, but I still think it is relevant to us as a society. So I'm just leaving this with you to a moment to read this through. And after that, maybe we are open to all your questions. Is it visible, readable?
Yes, yes, ma'am.
Okay, so this is it.
No,
I
no,
want to
no.
be a,
Ashla, some more time. I'm only halfway through.
Okay, so this is what I want to be. I want to be just another human like you. No special names. No, like I have special needs or I have different kinds of needs than you. But it would be so great if you could treat me as just as one another human being, just like you. So that's what I have. So I'm open to any questions before we go with our case presentation. I think Srinivas is doing a case presentation. Any specific questions?
How does the term specially enabled fit in? Like, because even the term disabled is sometimes discouraged. So can you share something about that?
Different people have different like opinion on that, but what am I trying to say is like Abhijit, uh, changing a name will not change anything for me until you make it accessible to me, until you welcome me as a person who can be with you, as a person who is same as you. Nothing changes for me. You call me whatever it is. I'm not an angel. I'm just a human being. And I have all the emotions which you all will be having. And you can't expect me to be something else than a human. So, but if you simply change the names so that
Yeah,
you denote or you respect me or you whatever you do, unless you help me contribute or you help me live a better life, it doesn't change
yes,
anything
yes.
for me. So
Yeah,
that is
yeah.
the only point I want. Some people go with disabled, some go with differently abled, and as long as they don't mind being called disabled, I don't mind like me being referred as a disabled person. But what do I demand is a inclusion so that it is all of us together in this life.
Correct. Correct.
Actually,
Thank
what
you.
was the title of your article in the Times of India when that act was passed? Do you remember?
Uh, sorry, I
Okay, I
have it
mean,
somewhere
maybe
here.
we can share the link of that article with everybody. This happened a few years back when India passed, after many years, the a joke. The parliament passed a joke, making the whole country accessible to everybody by law. Sorry, Srinivas, you still have your hand up.
Yeah, sir. Just I would like to add one comment and really thank the team actually for getting Ashla ma'am for as a resource person for this topic, and hearing from her experiences was deeply enlightening for me. And now I'm a totally transformed person. And madam, as you have posted in the last slide, you said that you spoke about one point. There is like the kind of architectural barriers you pointed out, but in the slide where you have written the barriers for the people with disability, you have not pointed it out, whether we can consider it also as a kind of barrier.
Architecture, yes, that is the environment. We live
Yeah.
in that environment, so that includes like all public places and everything where I like.
So, what would you suggest, ma'am? Like, what are the things which we worry, make you worry, or something? Some examples.
I didn't get you. Can you repeat that question?
In the sense, what kind of architectural barriers, like some like providence of the ramps, or in what way you need a barrier-free environment? We know that you need a ramp. Whenever they say that you need hand railings, we need ramps. That thing, or you have anything special thing because you have experienced it. You can give it in more in detail. But when
Okay.
generally when we talk about healthcare professional, they say that they cannot climb states, they need ramps. They cannot hold, we need to have a grab bar. We limit ourselves to there. But from your point of view, what more?
I think, but I will also be limited by my own experience of disability, because what do I see daily are my difficulties on how do I like find it difficult, because I need ramps, I need accessible toilets, I need like enough space for me to uh, go in my wheelchair. So these are the things which I will see, but that will be different from person to person, or the kind of assistive device which we use. But what do we need is an understanding that, okay, we need to, like, how do we, I tell this sometimes to people, like when we were at some point of time, we were walking. Then when we started like carts, and then we got this um, like cars, and then we got this flights, aeroplanes and all. So we never gave so much of thought that, okay, when we made all these big roads, we were giving up on space for agriculture, right? What did we lose? We lose space for uh, place for cultivating things, but we didn't see it as a loss, because we knew that, okay, that roads are helping us in many different ways. And when we made all these aeroplanes, and then we spent on uh, airports and all, we didn't see it as a loss. But when we think about making a ramp, when we think about providing a lift, when we think about having this accessible information, we always talk about cost. So it involves cost, but it includes people. So all these developments involve cost, but what it actually gave us was like freedom. We could use our time better. We could use our facilities better, and that gave us freedom. So we didn't think so much about it because the whole society was benefiting out of that. But when it comes to marginalized communities, we think a lot about the cost of making it and also. But I think that attitude should change, and we should consider that we are including everybody, we as a society. That includes me, who is not able to walk, my friend Tiffany, who cannot see, and my other friend, maybe, who cannot speak. So it includes all of us, and there should be facilities for all of us. And we never question, there is a 15-story building, and we never question about the need for a lift in that building. Why are we not? We have apartments, 40 story apartments, and why are we not questioning the provision of lift, the amount of money we spend on lift on that apartment, because it is not humanly possible to reach that heights without a lift. So when it is for you normal people, when it is not possible, that facilities which is provided to you, that we all entitled to that, we all feel entitled to that, and we don't question about that. But the moment it is given to a 2-story building, because my wheelchair cannot go, you question about the cost. So if we can change that attitude, we as a society will benefit from that. And I'll be a happy part of that.
Thank you, ma'am. Thank you for sharing that.
Abhijit?
Yeah, ma'am, what are some of the provisions by the government that are being done to bring the disabled community into the mainstream by means of livelihood and income, where they can feel they're being productive and contributing and also empowered because they're earning money. So is anything being done on that level? And if not, then how can society and community, what can they do? So
Okay, so that is what actually Dr. Rajagopal was also talking before. We have a very beautiful law and the article. So that is like named when compassion is not enough. So it is about we all have enough laws, we all have enough programs, but it is about how do we implement it, how is it reaching people, and are we actually providing or giving enough attention that it is implemented successfully. So actually there are a lot of programs, but again, it is all about how do we implement it. And it's already 4 o'clock. Senior, I'm so sorry. I was given
But
40 minutes time.
Sorry,
Yes.
Ashla, one word, just to add to that one word, according to that law, all public buildings have to be accessible.
Accessible.
All government offices, certainly. All public places. Ha ha ha.
And you see all these steep ramps in front of ATMs because they only have to report how many of their ATMs have a ramp. Doesn't talk anything about whether there is a closed door there. Is it open? Whether it that ATM inside that space, whether they can accommodate a wheelchair. It doesn't talk anything about it. So you see all these things there. A very steep ramp where you cannot even climb with your own legs, and there is a closed door many times. There is no enough space for my wheelchair to be inside. So because of all these things, there are rules, and this is how we.
Yeah, no, I mean, I meant to ask about the livelihood, because jobs that could be reserved, because I remember growing up, I used to see some PCO booths, public call booths that used to be reserved for the disabled. So has anything moved past that stage?
I don't think much.
No, okay. Thank you.
So we'll go with the case presentation. Senior, please take it from here.
Yes. Today we are going to have a case presentation by Mr. Srinivas. Mr. Srinivas,
Yeah, madam. Yeah, you can.
please go on.
Yeah. So myself, I am Jarapla Srinivas Naik. I am working as a physiotherapist at Nimhans, Bangalore. And now I'm going to present a case on next slide of a 42-year-old female who was diagnosed with thoracic level D8 and D9 intradural and extramedullary lesion, which is like they were suspecting it to be a meningioma, but it has to be confirmed by a histopathology report. And that because that lesion was compressing the structures around the cord and the nerves, so they have done a minimally invasive spine surgery, and they have done a hemilaminectomy and excision of the meningioma. And the date of surgery was on 15th of June. And coming to her occupation, she was a Anganwadi worker. Next slide. So coming to her medical history, she was apparently normal till the 3 years back, and slowly she developed a gradual ascending weakness, which started from the foot and gradually coming to the knee and hip region. And she was having problems in the form of she was wearing slippers, the slippers were coming off, and she has a difficulty in placing the foot properly while walking, and which is associated with some tingling and numbness of the right foot. And above weakness, as I said, that it was proximal, and gradually over a period of next 1 year, it started getting to the proximal region. And she was have her problems from the slippage of the footwear, and slowly they also increased. She was difficult, having problem in getting up from the floor, climbing stairs, and she also noticed gradual onset of ascending weakness. And since last 1 year, she developed a weakness in her left lower limb also, and she has burning sensation in the both sides of feet. And when we see her past illness history, she had like back pain, and she was taking some painkillers, and that improved after 2 months from a local doctor. Next slide. Coming to her past medical history, she's not a diabetic, hypertensive, and she had undergone postpartum sterilization that was 20 years back, and she had an history of her congenital talipes equinovarus deformity in childhood, which was managed conservatively. This is regarding her past medical and surgical history. And personal history: before the onset of these all issues, she used for the last 5 years, she's a pan and a habit of chewing this pan and gutka, and the frequency was 1 gutka per day. And now she stopped it after her illness. And post-op status now of her is like she's having bilateral lower limb weakness, picture of a paraplegia and sensory impairment below the level of T10. And she has a bladder and bowel incontinence. She is catheterized, and poor pelvic and trunk control, decreased sitting balance, and her MMT would be around 0. Next slide. And coming to her insight about the diagnosis, the patient family are aware about the diagnosis about that meningioma because it was explained to them by the treating neurosurgeon, and the family members are also well aware of it. And prognosis part, they are concerned because immediately after the surgery, um, there are immediately after the surgery, she had the weakness of the lower limbs. So they are concerned about their illness, whether she is going to improve, how long time it is going to take. But before the surgery, she was able to move her legs. But after the surgery, immediate post-op, the muscle power is 0. So they are little bit concerned about that. And the family wants her to recover as quickly as possible because she is Anganwadi worker, and the family members were depending upon her income also, and they are not at all aware about what is palliative care and how then palliative care can help them. Next slide. And this is a family overview. His husband is a daily wage worker, and he's a having water supply business in their village, and the patient herself is an Anganwadi worker, and they have one son and two daughters, and the son is 24-year-old, and one daughter is in 19 years old, and other daughter is 21, and she's married with a computer servicing man, and they're having a one son of 3-year-old, and one daughter, she's studying her degree, and the son works in an goldsmith, and he's a daily wage earner. And coming to her support from the surroundings, because they have their business, so their neighbors are taking care, and in her place as Anganwadi worker, she has given the work to some other person, so they are taking some amount of half of the salary, they are taking it, and half of the salary they are giving it to this patient. So in with their neighbor, the panchayat and all relatives are having, and they have a strong support from the family also, and the doctors and rehab team too. Coming to her socio-economic overview, they have like low to middle socio-economic status. Anganwadi worker getting hardly around 6,000 per month, and husband is also a daily age earner, and son is also a daily age earner in goldsmith shop. And financial constraints are there because now she's not working. Then the husband is also left the place and taking care of her, so they are having lot of financial burden constraints, and but somehow they have kept someone in their place, so they are getting a little financial support from them. Next slide. Coming to her psychological overview, they are worried about their condition after the surgery because she has developed weakness in the bilateral lower limbs. They don't know how much time will it take for her prognosis, whether she will be able to overcome or recover fully. They are not aware of it. And financial constraints, as because the two husband and wife are not working, so they are worried about their financial. And after whether she'll be able to get back to her work as an Anganwadi worker and do the same work, they have their issues about it. And but they are motivated to give their positive best sources. How much ever we are willing to sell our land or whatever, but she should recover. That is what they were telling to me when I was collecting the history from them. Yeah. Next slide. So if you put in a total picture of total pain, the physically she has both lower limb weakness. She couldn't sit properly because of poor pelvic and trunk control, and she has catheterized nursing issues, mobility concerns. She's wheelchair bound, and psychological, worried about prognosis, how long, whether, and they're all distress, socio-economic, financial constraint, job issues, but they don't have any spiritual thing. They don't, I didn't find anything they are relating it to that something has happened spiritually or something, or they don't have anything of that sort. And here, what I would like to listen from the people here is like, how to go about plan of care for this. Now she is being admitted in a neuro rehab setting where the doctors are taking care of managing her bowel and bladder concerns and giving her some medications to take care of that. And then from rehabilitation's perspective, in our center we have a multidisciplinary team where a psychiatric social worker, physiotherapists, occupational therapists, a psychologist are taking care, but still they are little bit worried about their illness. In what way we can handle their psychological issues, and what should be the priorities of the treating team, and is she going to require a continuous follow-up for recurrence because meningioma, whether is there any chance, and how to improve the quality of care of the patient and what needs to be focused on. So these are the discussion points I would like to bring up. Next. Yeah, I think this is what is there for the case presentation. And I thank the Pallium India team for this opportunity.
Thank you, Mr. Srinivas, for the case presentation.
Ashla, you want to take the lead in the leading the discussion?
No, sir, kindly, please do, because this is too
Yeah.
medical terms. So
No.
if you can,
Maybe,
That-
senior, can you go back to the last slide?
Sure, sir.
A few points, Srinivas, before we answer your questions. I don't know if during the course, the issue of spiritual care has been brought up. It was,
We had a session last Wednesday.
okay, it was discussed last Wednesday, and I don't know, I'm sorry that I was not there. When I talk about spiritual support, I don't necessarily mean something that is related to God or religion. It could be. It's about what connects the person to this world. For a lot of people, it's God. And at this point of time, it may be only God or religion or the chants or whatever they use it in their practice. But for a lot of people, it's not. It may be just, they may be more connected to their place of residence or the tree that they see outside the window, nature. And those things may be denied to this person. I really wish, Ashla, you had brought up comment, you had led the discussion. Because for a person living with poor accessibility, the rain outside is not accessible. The good breeze is not accessible. You only have the electric fan. And I believe for a lot of people, there can be major reasons for spiritual pain. For a lot of people, it's about, I mean, for anybody, it's also about having meaning to somebody's life. Life has to be meaningful. Many people are not doing a job just because you need the money. You may be doing it because if you get some satisfaction, you feel useful. You feel you are contributing to others. This is vitally important. I remember Ashla's article, which was the link which was shared here. And in that, one of the things that she says is, if when she did not use those words, if you just give love, you will ask me to remain in my bed, not do anything. Everything will be done for me. But that wouldn't be really life. For her life to be life, she had to be able to contribute to the society, contribute to other people who have disabilities, contribute to some of us who do not have disability. All that is adding meaning to life. So when we talk about spiritual pain or spiritual care, it's about finding out what connects this person to the world and facilitating that connection, including relationships, but also about making that life meaningful and purposeful. And this is as important here as to your grandfather who may be bedridden in that bed, who may be always praying, God, take me. And when somebody prays like that, it may be because they feel that their life is complete and there is nothing to be done. It may also be because I feel my life is meaningless. I am a burden to everybody. I do not want to live like that. We must go into it. When we do a spiritual exploration, these are the things that we go into. Sorry for that long lecture, but senior, go back to the next one, please, the issues. Srinivas, with your permission, we are not going to go into the medical aspects of the case.
Okay, sir.
I do not know enough, and we leave that to the specialists and doctors. But plan of care. Care is not only caring for the disease, it's caring for the person. So who wants to contribute an answer to that question? I see that we have about 10 minutes. Plan of care. And maybe connect that to the second question, psychological issues. Uh,
Yeah, hello. This is
yes,
Sajjan.
who is that?
Yeah,
Sajjan.
thank you,
Sajjan.
Ashlam.
Hey.
Yeah. Thank you, Ashlam, madam, for that insightful session on what actually disability is, and then also how we can help people to manage that better. And thank you, Srinivas, for this case study also. In this case, you mentioned in the one of the last slides that currently she is going through some care at the hospital itself, but then after she comes out of it, what next, kind of thing. So uh, uh, my thought that goes into is like to find out what kind of palliative care is available in probably in this whichever city she is. I mean, in Bangalore, for example, and then whether it is a paid service, whether it is an NGO, and things like that. How, or if they need to raise a financial support to be to make the palliative care available for us, how that can be done. This few things could be the initial few steps in terms of. And then also you mentioned that in the they are totally unaware of what palliative care is, so making them aware of what it is, and how it can help her recover, or towards steps in recovering and so on. So this, I think, are few initial steps that um, we can suggest to her.
Ashla?
Yeah, like I agree with Sajjan, wherein we need to have how do we go forward with the continued care which is required. If you manage to wean her from interlinked catheter, so that's good. If not, how do you manage? And the patient and caregivers education on managing daily day-to-day activities. And because I was in like discharged from a hospital after my surgery and acute treatment, without telling me how do I manage my bladder and bowel. Like, okay, for my bladder, they did say that, okay, it is, you have to change this monthly, that interlink catheter. But what about my bowel? I was never told about how do I use the suppositories, how do I schedule these kind of emptying my bowel, and also maybe they told me or my mom, but we both did not understand it correctly, and we did not know how to manage it when I was discharged. So checking that understanding of that person, if that person is bedridden, how do you prevent bed sores, further issues, and how do you actually get this person to, I saw that, okay, she's an Anganwadi worker. Can she do something from her wheelchair before, like while she's waiting for the further like treatment and curative treatment or rehabilitative or whatever it is? Is there anything which she can do while she's waiting for that? What happens usually is like the moment you have this kind of thing, the whole focus for the family and the other people are going on this curative part. You don't see the person. What do I need? I need medicines and I need my help, but I don't need just that. I need something to feel human again, to connect with me. So I never felt like myself because people were always talking to me as a patient. I didn't know my name because they were all calling me the patient of that case, patient of this room number, this bed number. So I lose a sense of like who I am. So if you can talk to her, listen to her, what she would like to do. She's only 42 years old. So there is life ahead. So if you can contribute on that also, just to get her think about it, not only about the disease and the current state, but also about what she had been doing, how she had been doing things and what she would like to do in future. Something which is possible. Start with some realistic goals and then build from that, because that adds to your hope when you're able to do something which is and achieve that. When you plan for something and achieve that, that adds to your hope. So that is my immediate thoughts.
To continue the answer, a little more from the physician's point of view and palliative care professional's point of view. You have asked how to handle their psychological issues. Of course, part of the answer Ashla has given. Sometime back once, in some context, I said our institution should be a place of love. Ashla corrected me. Ashla said love can, many people can give love. What we do not get is dignity. This person needs to be treated with dignity, Ashla said, not just as a patient, but as a person. Somebody has to sit down and listen to the person to understand what kind of person this is. What are her hopes? What are her ambitions? She needs to know the truth, but the truth should not be given like a bombshell. If her chances of recovery are poor, that needs to be gradually disclosed with sensitivity without destroying hope. It's most important to sustain hope. Always point to something achievable in the immediate future. That would be one way of instilling hope as she struggles to come to terms with a bad prognosis, if the prognosis is bad. The priorities of the treating team is already obvious in the previous answers. It should be to help her to live as active and meaningful a life as possible for the rest of her life. But the family said, we will do anything. This is harmful. They will do anything. Then that neighbor says, go to Hyderabad and get this fish treatment. And somebody else comes and take her to Vellore. And people will have different opinions. What the treating team can do is to find out the real options and sit down with her and family and give the options honestly. What components of quality of life is to be focused on? That depends on the person, the priorities. Certainly, physical, social, emotional, spiritual, financial, everything is important. But from that person's point of view, what may be most important now would be just get somebody to open that window. It's raining, I want to see the rain. Think of small things, but think also of the bigger picture. Ashla, please comment. I'm here talking as with an inferiority complex, actually, because you have gone on that journey. You are the most experienced person in this room.
Yeah. Like, I completely agree about giving that chance, like giving her an option to decide, because that is for many people, whatever is important, the treatment, the curative part of it, what are you going to do and all. But for this person, something which is very small as, okay, ensuring that like daughters, maybe the daughters exams, or something which is more important to her, which may be not obvious to all of us. So give that decision to her, so that ask her, okay, what would you like to do? How would you take it forward, so that she gets some sense of, she gets an opportunity to open up. Many times we assume that, okay, this is what this person needs, and then you give me everything, but the moment you ask me, I get a chance to actually think about, because we keep forgetting when she is having, she was going through all these for last 3 years. We don't know the complete focus of her life was, and her caregivers focus was on this disease. How do we manage that? How do we get out of this? And then during that time we forget who we are as a person. So only after so many years, when somebody asked, okay, what would you like to do? And that's when I actually got back and thought about, okay, what did I like? Then I came up saying that, okay, yeah, I knew that I love books, because without that I can't live. But otherwise, other than books, what did I like? And that's how I understood that, okay, I used to love walking. I used to go for walk when I was disturbed, when I want a break, or when I, like, that was something which was so refreshing for me, which I never did that. But I actually forgot that as a person, because every time, every day, it was like getting up and doing physiotherapy, doing something, have some for like goals on physiotherapy, learn to get up and sit, learn to use my laptop, learn to write again, learn to like feed myself again, how to use a spoon, which spoon is more heavy, which one can I use? And these were all my daily worries, and I forgot what did I actually like to do. So only when you give a chance to that person, ask these kind of questions, that they get a chance to actually look back and think that, okay, I had all these in my life, so maybe I can still do something going forward also. There is something which I can focus on. Because the caregivers, the family at that point of time, they are also going through a lot, and they may not be able to ask these kind of questions or look at it from this point of view until we healthcare professionals help them do that.
And that is the true spiritual care, giving that purpose to life. But I have crossed time limit. Senior is looking at me with anger. Wait, Rama, I both as a journalist and as a human being. Any comments?
Actually, I write a lot on disability rights, and one thing that I think I have learned from talking to and covering issues of disability rights is that one of the things that's very really irritating for people with disabilities is society assuming what they can and cannot do. And we see that fundamentally when the government is trying to identify jobs for them. There is a bunch of bureaucrats sitting in a closed room and deciding what a person can and cannot do, and they don't even know that person. Often they end up, barring them from jobs which many of them can do. And they assume that they should be telling them what they can do. For example, they tell them many people with disabilities want to become doctors because they have seen what doctors can do for people with disabilities. So they also want to be able to help other people with disabilities. They want to be useful. They want to be of some purpose. But we have a lot of restrictions in medical council rules about who can become a doctor. What are the abilities required to become a doctor? And I have often found that that's really frustrating for people with disabilities, that people who have never met them even once presume they know what they can and cannot do. And just like, if I don't know, if I know that I'm not very good in mathematics, I would not apply for engineering and try to become an engineer. The same way, a person with disability knows what they can and cannot do. So a person who does not have use of both hands might not apply for surgery knowing fully well that they can't do it, but they might apply for something else, like becoming a psychiatrist or a psychotherapist. But for you to assume what they should or should not choose, or that they can't decide what they can, I find that it's incredibly frustrating for them. It's incredibly frustrating for people who try to write about their rights, because there's such a block in people's head that they need to tell them what they can do.
Thank you, Raman. Thank you. Yeah, collective voice will be necessary. Yes. Senior.
And I would like to thank all the members for those insightful thoughts and helping me out. Thank you all.
Thank you, Srinivas, for the presentation. Senior, you have excellent time by 6 minutes. I'm sorry about that.
Sorry, sir. And thank you all for being here today. Special thanks to Ashla ma'am, Rema ma'am, and Rajagopal sir for being here with us. Thank you all for joining us today. The feedback link will be shared in your WhatsApp group. We'll see you on the next session. Until then, bye.
Bye-bye.